Okay, so today I'm going to walk you through how to look at your different prescription drug plans and be able to choose the one that you want. Now, some of you already have a broker that will do this for you, or maybe you've called around looking for help. I'm going to step by step show you how to navigate the medicare.gov website that has all the prescription drug plans in your zip code. So while you're watching this, the best thing I always say is pause it or rewind it if you miss something, but I'm going to try to go as slow as possible. All right, so the very first thing you want to do, even while you're watching my YouTube video, you want to go up and get a new window open. And you want to, and I'm going to try to make this not so loud, you want to go to medicare.gov. Now, this is obviously the Medicare website, the government's website. So you're going to scroll to the middle of the page right here. Now, this is for anyone who you might not have. Some people have a login. Some people want to create a login. I wouldn't create one, especially when you're watching this video. Just go to Find Health and Drug Plans and hit Find Plans Now. When you click on that, it will take you to this page. Now, over here on the right, you'll see it's a zip code, coverage for 2023. Obviously, that's what people are going to be doing now. This is for October 15th through December 7th when you can switch your prescription drug plan. So you're going to type in your zip code, and I'll just use the zip code I used to live at. Then you're going to go to select a plan type. Click the little arrow. You're going to click on just drug plan, Part D. You don't want to mess around with this other stuff like drug plan plus Medigap plan. Don't do that while you're looking for a drug plan. It will just be confusing. So you hit drug plan, you hit apply. Now you have your zip code and that you're doing a drug plan, and you're going to hit start. I know I might be talking like I'm talking to a third grader, but I watched some of my other videos and I'm a fast talker and I don't want you to miss anything. So help with your cost. Do you get help with your costs from one of these programs? Medicaid, supplemental security. Most people that I've worked with do not. And I always click the last button. I do not get help from these programs. I don't hit I'm not sure or any of that. I don't get help. Then you hit next. Do you want to see the drug costs when you compare plans? That's the only thing we want to see, but for some reason that's what it asks us. Asks us. Sorry about that. So then you hit next. Now, this is going to come to a page where it says add prescription drug. This is where you're going to type in your drugs. Now, let's start with one drug. We'll put in Flovent. Now, the reason I'm putting this in is because some people take Flovent, some people take the generic. Now, as an agent, people will say, oh, I take Flovent, I take Lipitor, and what they really mean is they take the generics. They're not actually taking Lipitor. They might be taking rosuvastatin or simvastatin or whatever the generic is of the brand. But when you type in the brand and you hit add drug, it will say a generic is available. You have to look at your bottle. Are you taking the actual Flovent or the generic? If you're taking the generic, you're going to hit add generic. And then that's going to pop up to this page, which will ask the dosage and the, whatever it is. And you put that in there, 16 GM bottle, and then quantity. Are you taking one every month? Are you getting one every 3 months? You'll put that in, and then you'll put add to my drug list. Now, most people are taking more than one drug. If you're done after one drug, you just hit done adding drugs. If you're taking more, you just hit add another drug. Now, that other drug is still saved, the Flovent. Now you're going to just let's put in rosuvastatin. Now they will pop up as you see it. I only put in ROSU. It pops up. I click it there. I hit add drug. This is already a generic. So I add the drug. What's the dosage? We'll just leave it at 20, but you can 25, 10, whatever it is. 30 per month, meaning one a day. And then add drug to my list. Now, as you can see, here's your list. You can keep adding drugs right here. Doesn't matter if you have 2 or 10. when you're done, you just click Done Adding Drugs down here. I'll scroll up a little bit. Done adding drugs. And then it will come to a page where choose up to 5 pharmacies. Now, some people say, excuse me, I'm drinking coffee. Some people will say, well, I go to CVS or I go to Walgreens. But here's the thing. You want to choose multiple pharmacies, and I'll explain why. So I always choose the mail order option up here. Then I choose some of the quote-unquote brand name pharmacies, CVS, maybe Rite Aid, maybe Walgreens. And then if you go to one of the local pharmacies or something, click that on there also. And I'll explain why. So once you're done, you'll come down to the bottom right-hand corner. You'll click Done. Then it will load, and now you're on the page where it shows you the actual drug plans. So I have up here to the right, it shows lowest drug plus premium cost. Now, there's 3 different things. You can put in the lowest deductible. So this plan will have a 0 deductible, obviously. But look at the monthly cost, $71. You can put in lowest drug and premium cost. That's actually for the year. So, yes, it has a monthly premium of $11. It has a deductible of $505. But the yearly cost is the lowest, which is $253 for the year for those 2 drugs. I always do the lowest drug and premium cost because you want to see, even though there's a deductible, if it's a cheap drug and you're only paying $5 for the drug or something, it's not, your deductible is not going to matter that much. So I always use this one, but you can put in lowest monthly premium also. But I want to know what's costing me the most every year for the year. Then, see how it says down here, open enrollment starts October 15th. Let's just say you knew that you wanted this plan. After October 15th, there will be a button here that says sign up for the plan or something like that. But they're not going to have that until after the 15th of October. But I want to compare a couple plans. So let's take this one and let's just compare the first 2. Both for the yearly cost. I'm going to click on added to compare. It's going to show down at the bottom, as you can see. Then I'm going to hit compare. So now you're going to pull up the 2 plans. You see there's Wellcare up here, and then there's also Cigna. Now, you compare them side by side. One's $12, one's $11. No big deal. But here's where it gets interesting. Which network is in pharmacy and which is preferred? Well, for this Wellcare up here, the preferred pharmacy is CVS. So if you're going to choose this plan, you better make sure there's a CVS around you, or that's the one you're going to want to go to. Because look at here, Rite Aid is costing you $493 a year. CVS is costing $253 a year. You're not going to want to go to Rite Aid anymore. But on the other plan, look at, it's the exact opposite. Look at the numbers. So you're going to want to go to Rite Aid if you get this Cigna plan, and you're not going to want to go to CVS. I mean, look at the difference. It's really wild. So let's just say, okay, this one's $268 a year. This one's $253. Let's say you want to go to CVS. Okay, let's check this plan out. So you hit plan details. Then you'll come to this page. Once again, up here where it says open enrollment, I'm figuring that they will have, this is where you can sign up and click sign up. That could be tricky also. Signing up on here, I would be careful of that. If you have someone that takes care of your Medigap plan or Medicare supplement plan, if you do the legwork here and you call them and say, look, I want this plan, at the very least, they'll be able to walk you through the sign up here. Maybe they'll do it for you. Or you could call non-members and sign up over the phone, which might be tricky because they're busy during this period. But I always help my clients where I will sign them up. They're on the phone and I'm just saying, all right, I'm clicking this, I'm clicking that. Or you could do a Zoom call, whatever it is. I don't want them to screw up and get the wrong plan or whatever it is. Anyhow, so you go through and you look at monthly premium, drug deductible. This is just the overview. Now let's look at the actual coverage. Once again, it says CVS is the preferred or mail order right here. So let's go down. Let's check out the CVS. We're not going to look at Rite Aid or this other Empire Pharmacy. CVS, $60 for the year for this Flovent generic. What about rosuvastatin, your statin drug, $60 for the year. $120 total year drug cost. Now that, let's scroll down, total year cost, such and such. But let's look at the monthly. This is what I always look at first. And I usually go a lot quicker than this. But estimated total monthly cost. Now, if you look, this is going to be January, $10, February. Every month is going to cost this person $10 for those two drugs. The plan itself, what was it? I'm going to scroll up fast. The plan itself, Wellcare, was $11.10. So you're going to add that $11.10, your premium per month, to this $10. Obviously, it's going to be $21 per month that you're going to spend. Let me scroll up here. So 21 times 12 is going to give your total yearly and premium cost. And that's basically it. So once, if I was doing this person's plan, I say, hey, this is a cheap plan. This is inexpensive. So I would tell them to either click on the button here, wherever it's going to be. They don't put the button on there until October 15th. Or I would do it for them. Or they could call the non-members and just sign up over the phone. You might have to wait, but if you're doing a lot of plans like myself during this time, I'm either going to advise them to call or I'm going to do it for them. If they really want to do it themselves, so be it. I don't really care. Just the service that I provide, and most agents that I know are just providing this service, or they're giving them somewhere to go where they can sign up themselves, but this can be tricky. So I hope this helped. If you have any other questions, leave a comment or question in the box below. I'm going to be checking this sporadically throughout the open enrollment. So if there's questions, I want to help people out, I can do that. Thanks for watching the video. I'll see you at the next one.